How does ADHD, brain reward system dysfunction, cause addiction? Imagine feeling like your brain is always craving a boost, but normal activities just don't give you enough. That's what happens with ADHD and how its reward system works. When someone has attention deficit hyperactivity disorder, their brain's reward system doesn't function the way it should. The key player here is dopamine, a chemical messenger that makes us feel pleasure and motivates us to repeat behaviors. In people with ADHD, the areas of the brain involved in reward processing, like the nucleus accumbens and midbrain, have fewer dopamine receptors and transporters. This means their brains don't produce or respond to dopamine as strongly as in people without ADHD. As a result, everyday activities like eating, socializing, or completing tasks don't give enough dopamine to feel satisfying. This makes it hard to stay motivated for things that aren't immediately rewarding or exciting. Because of this dopamine shortage, individuals with ADHD often seek out behaviors or substances that cause a quick and intense dopamine releases. Substances like stimulants, nicotine, alcohol, and opioids can flood the brain with dopamine, giving a temporary feeling of pleasure or relief. High-stimulation activities like gambling or scrolling social media can also trigger these dopamine surges. Over time, relying on these external sources can create a pattern where the brain starts depending on them to feel good. Normal activities become dull or unfulfilling, and the person might develop compulsive behaviors or substance use to boost dopamine levels. This cycle is reinforced because the ADHD brain's reward system is less responsive to typical rewards. The brain begins to crave stronger stimuli to feel motivated or happy. Genetics can also play a role, as some gene variants reduce the number of dopamine receptors, increasing the risk of impulsive and addictive behaviors. Recognizing this connection highlights why tailored treatments are so important. Medications that boost dopamine, like stimulant drugs, can help improve attention and motivation by balancing dopamine levels. Creating environments with immediate, meaningful rewards can also help reduce the urge to seek out addictive stimuli. In essence, when the brain's reward system doesn't work properly in ADHD, normal activities don't feel rewarding enough. This makes individuals more likely to turn to substances or behaviors that give a quick dopamine hit. Understanding this link helps us see why managing ADHD involves not just attention but also addressing the risk of addiction. It's about finding ways to support the brain's natural reward pathways and reduce the need for external boosts.